Hello, everybody. I'm Derek Arden, and welcome to Monday Night Live. Today, I've got Alison Grose, who is a physiotherapist, and in fact, has been my physiotherapist for longer than I'm allowed to tell you, because that will be giving our ages away, Ali, wouldn't it? And you never give ages away. I played a lot of hockey in my life, and I did all sorts of damage to my back. And when we moved to Guildford, I couldn't find a physio that would understand the mind-body connection. So I searched around, went to about 5 different physios, and finally, thank goodness, found Alison, who understood that the body and the mind all connected in together, and you had really to connect it, be sensible, do the stretches, etc. Alison, thanks for joining us. Really appreciate it. Since we last met, you have sold your business, and you're now just being a physio. So
Right.
tell us what happened in the first 25 years of your life to make you want to be a physio, and then after that, tell us why you sold your business.
Okay, well, good afternoon, everyone. Great to see you all. So the first 25 years of my life were quite very outdoorsy, very sporty. I was quite a sporty kid and rode a lot of horses and just had a great time, really. So then I met a fearsome physiotherapist called Audrey, who invited me to go along and to her clinic to see what she did, because she thought I had the good makings of a good physio. So off I went, naive at 15 years old, in my best shoes and t-shirt and everything. And she proceeded to tell me she was going to fix this man's back. Fix. And she got this very large guy on the bed. She was no small woman, I can tell you. And she literally leapt on his back, shoved her knee in it, pulled him up, and it was an almighty crack. He fainted. And she then slapped him around the cheeks and said, "You're all fixed now, off you go." So that was my very first look at a physiotherapist.
Wow.
So
Isn't that
yeah,
isn't that what a chiropractor does, or not?
it was a bit like a chiropractor, but yeah, probably a bit like a chiropractor. But nobody's supposed to make you faint. I mean, that is
No.
not the aim of the exercise. However, apart from that, she was actually a very eminent physiotherapist, and we talked a bit. And she was very tough, but she put the seed in my mind, and I found out a lot more. And I just thought, this is going to be what I want to do. I did consider medicine, but I like to be with people and chat to them a lot, as you probably will tell from today. So I felt that perhaps physio would be the best route for me. And do you know what? It was, and I've never looked back. It's the best thing. So that was how I came to be a physio. And I did the usual route of A levels. And in my day, we trained in hospitals and then went out to work in the hospital wards or hospital clinics and things. Now it's, of course, a university degree where they do modules at university and then go out on placement. So I worked for the NHS to start with, and then set up my own business with a friend, which we had for 27 years. And I've just recently sold that, actually, because I decided, lots of reasons, but my main reason was we needed to move premises, and I didn't want all the hassle of finding all of that. I'm at the stage in my career where my patients are well, they've always been the most important, but I didn't want all the extra stuff. So now I work they call me a consultant physiotherapist. So basically, I go in, I see my patients, which is the bit I love, and I have no responsibility for the running of the business. So actually, it's all good.
And what made you leave the NHS? What was the motivator there?
Well, that was a kind of mixture of things. So when I was actually quite a senior physiotherapist in a different area when I left the NHS. I was a paediatric physiotherapist, worked with very sick kids and intensive care and that kind of thing. But I also did sports injuries in the evening. So anyway, fast forward a few years, I had my first son, and I couldn't go back and treat all those sick kids, because I now empathise with what their parents were feeling. So I thought, what can I do here? I wanted to work because I've always worked and I love it. So I had a friend who had a sports injury clinic in Guildford, and he offered me some part-time work. So I did that once I'd had Freddie, and it grew from there, basically. And that's where I met you, Derek.
Fantastic. What a result that was. You kept my hockey going for quite a long time after I should have probably packed up, which was fantastic. Thank you for that. Now let's talk about the mind-body connection, because a lot of people don't believe that the mind and the body are totally connected. I do, for sure, and I know some people on here do, but tell us about that. What's your view?
My view is that you can't separate them. It's all one thing. So, and I think people go wrong when they try to think of just their foot, just their back, not think about their brain and their mind and everything else. I mean, it's proven that if you can have a positive idea of how your injury is going to heal, you heal quicker. And, you know, I've seen that many times, elite sportsmen being a good example, but even just determined people. Now, that's not to say that you can just heal yourself by thinking about it. I wish it were that simple. But what I do think is that if you have a positive attitude, it makes you open to take all the suggestions that are given to you. And, you know, your brain is a very pliable thing. Its cells can change. It's called neuroplasticity. And if you keep on practicing that exercise, that stiff knee that after the surgery will eventually get going, not just because you've done it physically, but because mentally you're teaching it to start working again. That's just one example. But also I think let's go a little bit differently to that and talk about the effect of stress on the body, because if you are very stressed, there's no doubt about it that these symptoms of the stress can what we call somatize, which is where they come out into your body. So that might be a headache, a stiff neck, a sore back, mainly that kind of thing. And if you think about it, if you look at a very stressed person, how do they look? They look sort of very, ears are up around their shoulders, very tense, often very tight, and they forget to breathe because they're so worried and thinking about the next thing. So all of that then makes your muscles tense, makes your joints stiff, and then everything starts to hurt. So that's a direct link between stress and the body, and the physical body, if you like. So yeah, the answer to the question is I truly believe that the mind and body is one thing.
And the other thing is working at a computer. We've talked about that quite a lot, haven't we? That, you know, very often your shoulders are up, you're concentrating, you're looking, you know, well, you're answering the boss's emails. Maybe he's giving you a telling off or whatever. I was nearly used a rude word there. But you recommend people standing up every 17 minutes or something like that if they're working on a computer?
Well, I mean, yes, I'd like people to move every half an hour, really, because I think 17 minutes is not very long when you're doing an important document. You know, you've just got your head around it and just got it sorted out. So if I say to you, okay, Derek, every 17 minutes move, you'll get to your 17 minutes and think, oh, I'm too busy. Whereas if I say to you, okay, Derek, let's move after 30 minutes, get up, stretch, move a bit, sit down, then you're more likely to do it, I would say. But yeah, you shouldn't just sit there. And of course, that's the problem with a lot of the youngsters today as well. They do everything on their screens, they're on their PlayStations, etc., and they get involved and they just forget to move.
Okay, well, we've got a couple of great questions here, so I'm going to read them out very quickly. The first one from Jill. Some years ago, a colleague of mine came to work on a Monday, hobbling and clearly in pain. He was an active chap, not sporty, but a keen ballroom dancer. Jill asked him what he'd done. The answer was gardening. Would you dance without warming up? And would you garden without warming up? What's the answer to that one, Ali?
The answer to that is I would not do anything physical without warming up. That's the actual answer. But seriously, we've got a little phrase for that. We call it weekend warriors. So it's often the person who sits at their desk all week or sits at their computer all week and then thinks, right, this weekend I'm going to get that hedge down, I'm going to dig up that flower bed, I'm going to build that, whatever it might be. But because it's a task, we don't see it as exercise. But of course, we're probably asking our body to do quite a lot of things that it's not used to. So it's always beneficial to actually do some stretching before you start, really plan your tasks and think about how you're going to do this, and again take some breaks, because it's that, you know, you've got all 20 bags of compost, your back starts to hurt and you think, oh, I'll just ignore it. So you ignore it, move the 20 bags of compost, and the next day you can't move. So you have to listen to your body and do some stretching and get strong as well. That helps too.
And we're going to have a look at that in a minute, aren't we?
We are.
Great. And from Godfrey, always a big question, does mental stress cause physical symptoms? We've covered a little bit of that, but that's a very, very direct question.
I believe so. Yes, I think it does. As I alluded to earlier, if your mind is in turmoil, it does have a big effect on your body. So that might be because you're in a tense posture, might be because you're not breathing well, because anxious people who are very stressed don't use all their lungs. They just breathe with the upper chest, and then you get a poor exchange of oxygen, etc. So you begin to get lack of concentration, and the more stressed you are, the less it's easy to concentrate, and too much adrenaline flows around the system. I'm sure all heard of the fight and flight mechanism. So basically, years ago when we were running away from tigers, we needed a big surge of adrenaline to be able to run away and then climb a tree, and then everything would calm down. In the modern world, of course, the stress is always there, but we don't run away from it. So that adrenaline keeps on coming, and you don't get the release afterwards, which makes the body more tense. So you can get all sorts of problems, irritable bowel problems. Well, there's many things that you can have. So yes, is the answer to that one.
Most of us aren't conscious of our breathing, though, are we? You just made me conscious. I'm thinking about taking some deep breaths as you say that, but most people aren't conscious of their breathing most of the time.
I don't think so, because it's something that just happens, isn't it? So, but the more stressed one is, the shallower you breathe, and the less, as I just said, the less oxygen you can get into your system. So I've got a little phrase which I call SOS, sigh out slowly. So if you're feeling stressed, you sigh the air out. So your out breath should be longer than your in breath. Because if you think of a stressed person or someone having a breathing difficulty, they will keep trying to breathe more. Whereas if you sigh out, it actually calms everything down and causes chemical changes in the brain chemistry and the body chemistry. So SOS, remember that if you're feeling a bit stressed. Just
repeat that again. Sigh out.
Sigh out slowly.
Sigh out slowly, like that. Okay.
I mean, there are many ways of breathing, but actually, if there's this, you can breathe in for 7 counts and out for 11. You can bring, just as long as the out breath is longer than the in breath.
Godfrey's last question is, it links to adrenaline, just, and us wanting to go to the loo. I can always remember before I was going to play an important sports match, I'd want to go to the bathroom and get rid of some of the weight in my body. Is that the same when you're doing an important gig or theatre or? Actually,
so it's interesting that the adrenaline release can be for pleasure or for fear. It's actually the same system. We have a lot of nervous system in our gut, although people don't realize that. You produce more serotonin in your gut than you do in your brain. Right. So when you are producing a lot of adrenaline, it can affect your stomach. That, butterflies in the stomach is a very real thing. It's an old-fashioned expression, but it's actually a chemical change in what's happening with your neurons. And so yes, it can send you rushing off to the loo.
Okay, now we're going to look at a few stretches now, and you need to credit the people that have given you these stretches, because that's the right thing to do here, because there's some good pictures coming up here which I'm putting up. So if you do that, I will get the first picture up.
Okay, so you're going to see a few pictures of some stretching that I recommend, and I use a program called Rehab My Patient, which is an exercise prescription program. Absolutely fantastic. I can tailor the amounts of exercise that I recommend to people, and I can email it to them, so it's there on the phone or the computer. So yeah, just like to credit those guys. So this first stretch is for you gardener and DIY people out there, or anything that's quite physical, and this is just to get your lower back and your middle back moving a bit. So you would just stand up straight. She doesn't look like she's standing up straight, but she is. And lean your arm down the side of your leg. And you want to be sure that you're not leaning forward or backwards. So you need to be in a nice upright position and just glide sideways. If you lean forward a bit, you can go further, but you're not really stretching yourself properly. So you do that and you hold that for about a count of 10 and do that 3 times just to loosen up the joints and the muscles in the lower and mid back. So that's that one.
I do find that a good stretch, Alison. That's I'll get a few clicks out of my back out of that. While we're on clicks out your back, what's clicks all about anyway? Always a bit scary when your back clicks.
So, okay, so if a click happens naturally, there's absolutely nothing to worry about. It's a change of pressure in the joint, or it's a ligament jumping over a joint. And then a natural click is absolutely fine. What we have to be more wary of is continual manipulation type clicks, because if you have that done frequently on the same joints, it can cause, in the long term, a little bit of too much movement in the joint, which as we age is not a good thing.
Okay.
Arthritis, etc.
Next slide.
Okay, so this one is for your calves and the hamstring at the back of your leg. So this is a great one if you're about to go hill walking or running, definitely for running, and also for doing things in your garden, because you loosen out that long chain of muscle along the back of your body. Now, the reason I've chosen this with her arms up is because it actually means that she's stretching her shoulders and her back a bit too. So I've tried to choose things where you get a lot of benefit for not too much effort, if you see what I mean. And again, any stretch, you're going to hold that for a longer time. So 10 to 15 seconds for this, and repeat on each leg, obviously, twice on each leg, before and after activity. So that's that one.
Okay, next one. coming up.
Okay, so this is my favorite exercise for posture. So this is not quite so much the gardening one, or this is the general thing that we should all be doing. We all sit with our shoulders up too far up to our ears and too far forward, generally speaking. So this is called scapular setting. Your scapula are your shoulder blades, and they are the balancer for your shoulders. So if they are in a nice position, your shoulder joints and your neck can move much more freely, the muscles can work better, and you're going to have less likelihood of having any discomfort.
And that really is putting your shoulders down and putting your back.
Shoulders back and down. I don't force them, just naturally put them to down in a soft V. I always say a soft V towards the middle of your back.
The reason I'm asking you that one is because that's one you generally nag me about when I walk into your,
I think I nag most people about this. I nag myself about this.
Okay.
So,
I thought it was just me. That makes me feel better. Good. Right. Next slide.
Okay, so here we've got some lumbar spine loosening, perhaps when you've got a bit more time after you've finished doing your activity or your exercises. So you're going to lie on your back with your knees bent, and you're going to let your legs go over to one side, and then your head go to the opposite side, which the slide doesn't show very well actually, but to get a decent stretch, you take your knees over, you never push them. You do this about 5 times, and each time hold it for, I would say, a deep breath, and then let go and come back to the middle and go to the other side. And after 5 times, you should have got a bit more release and gone a bit further, and it will loosen out those tight joints and muscles in your lower and mid back. So this one is for tight muscles at the back of your leg and also for your back. And you hold it for 10 to 15 seconds and do it 2 or 3 times on each leg.
This is taking up a lot of time, Alison. We're very busy people. What have you got to say about that?
Do you know what? I'm giving you loads here. You can do less than 5 minutes of stretches before you do activity, and probably 5 minutes afterwards, and that would be enough.
Okay, great.
It's because I'm naturally on talking about it, but actually when you do it, it doesn't take that long.
Sure. Okay. Next slide.
Okay, hamstring stretching. So after you've done your exercise or running or walking, you might need to stretch out those tight muscles at the back of your leg. Good for cyclists, Derek. And you basically hold on to the thigh and then stretch your leg back till you feel a nice stretch all down the leg, never causing pain, obviously.
These are great visual exercises, aren't they? I can see that you're pulling those hamstrings up. Is that one of the things that sports people pull very often? Hamstrings.
Sprinters, people who do explosive sports, so footballers, rugby players, tennis players, anyone who runs very quickly off the spot, if they don't have their hamstrings well stretched and strong, are more vulnerable to hurting them.
Elite sportsmen like Godfrey and Tony and Paul, like and me, yeah, absolutely. Fantastic.
Doesn't matter if you're elite or not, this is going to be good for you.
Okay. Right, we're going to the next slide now.
Okay, so this is another one for the posture and to help your upper back. So you're imagining that you're holding a band, and you've got your hands flat facing the ceiling, elbows in, and you take your hands out to the side. And what that does is strengthen those scapula, the shoulder blade muscles that I was talking about. So you would do at least 10 of these and hold for 5 seconds. You can do this anywhere. This would be a good one to do at your desk.
Yeah, I'm doing it now and I can feel it. It feels really good at the back, actually.
It does. It stretches everything out and it strengthens a bit too.
Yeah, I think I'll do that on the train going into London tomorrow. I don't care what people think of me, but
depends how crowded it is, I think.
Absolutely. Right, next one. What's this one?
Okay. This is a bit, so we're going on to a bit of strengthening now. So I'm sure most, or maybe you haven't, but we all should be looking to keep ourselves strong as we age. I mean, any time in your life, it's good to keep strong. But as one gets over 40 or 50, you do lose muscle mass. That's a natural process. And it's important to work to keep that muscle mass and to keep your bones strong so that you're going to be a very chipper older person. So this is basically a wall press up, just as it looks. She's standing with her hands on the wall, and then she's lowering her nose towards the wall and then coming back off again. And she's going to do that 5 to 10 times slowly. And she'd be strengthening her, if she's keeping her tummy pulled in, she'd be strengthening her core muscles and also all the shoulder blade muscles and arm. You
said that strengthens bones as well. How does that work?
The muscle pulling on the bone helps to strengthen the bone. So weight bearing exercise, it's called. So if you want, if you've heard of osteoporosis, where the bone's thin as one gets older, or take long-term steroids and things, this will help to prevent that, because using the muscle pulling on the bone increases the blood supply, makes the bone lay down new cells, keeps it strong.
Fantastic. Okay. Next slide. I don't know how many more slides we've got left, but we're
nearly done, actually. I think there's 2 more to go. Okay, so this is another strengthening one. She's sitting against the wall and sliding down, not to 90 degrees, but just to about half the way towards that, holding it for 10 seconds and then going up again. So this is to keep your legs strong, your leg muscles strong, so that you, again, keep your bones safe, keep your muscles safe, and you can climb all those hills and stairs when you want to go out for a hike. The next slide actually is for people who've got poorly knees, because if you go in this one, she's not going down as far, because if you do go too low and your knees are sore, it will aggravate them. But you can safely do this. It's called a quarter squat, to about 25-degree bend in the knee and the hip rather, not the knee. And you just hold that again for 5 seconds, 10 to 20 times. You don't have to do the strengthening things every day. The aim would be to try and do them 3 times a week.
That one I haven't done that one for a long time, but it reminds me, it hurts a lot, doesn't it? That one, I seem to remember, or is that because I'm not fit?
It's because you're not doing it right.
Okay.
You're not supposed to cause pain with any of the exercises. You can feel the muscle working, but it's not supposed to hurt.
Okay, brilliant, brilliant. Okay, so we'll look and see if we've got any questions on that, but let's just talk for a minute about some injuries. So let's talk about, just for a minute, about my dislocated finger. Now, when I turned up with you to your private physio practice, my finger was like that, and you started nagging me as usual that I've got to bend it, and that really hurts, bending it that far. But why do we have to stretch muscles when we've injured them early?
Okay, so actually with the hand, it's not just about the muscles, it's about the joints and the ligaments, it's the whole thing. Hands are made to be very active. They do a lot of stuff. I mean, obviously we use them all day, but if you don't move them, they seize up very quickly, because they're naturally joints that move all the time. They will seize up, and then it's very hard to actually get them going. So the answer to the question is, if you don't move things after injury, there are obviously provisos with some injuries, so you should seek advice. They can become stiff, they can heal with a bit of scar tissue, and then you can never get them quite back to the range of movement you had before. So early mobilization in most cases is the most important thing. It gets the blood supply going, it helps the pain relief, and it generally makes you feel better, because normal movement doesn't usually hurt. So
okay. And then on to the football question. In the old days, when I first played football, all you got if you got injured was a bucket and a sponge man who came flying over to you, which was pretty useless. And then it turned into, you got to get ice on it as quick as possible. And now I hear it's got to be ice, and then it's got to be warmth, and then it's got to be ice again. So what's going on there?
So sports science is always developing. There's a lot of research going on all the time. You know, if you're talking about your elite footballers, there's a lot of money in them not playing. And any elite sportsman, it's a big deal. So all the time there's research going on. And what we're really trying to do is increase the circulation to get all the healing blood cells to the injured area. So at the moment, yeah, we say ice and heat alternated is the best thing to do. Okay.
And where does things like ibuprofen come in to it?
Well, that's a debatable one, because some people don't like it, because they say that you're dampening down the body's natural healing response. So generally, ibuprofen it's an anti-inflammatory treatment, so it will help to calm everything down. So usually in the very early stages, it's a good idea, because it stops the pain. And of course, if you're in a lot of pain, it's much harder to move. If you can control the pain, you can move, and you can start doing your exercises and get the strengthening and the mobilizations going.
Okay.
So just don't take it long term. That's the answer to that one.
And then you're a great one for using laser and ultrasound, and you mean that nowadays physios don't tend to use that so much as just giving you stretching exercises. What's the difference between laser and ultrasound?
Well, the difference is easy. So ultrasound is, as it sounds, sound waves, which vibrate the cell membrane of each cell around the injury, around the area, and encourage the cell to push out inflammation. So it's actually increasing the circulation at the cell membrane. The laser is a beam of light just above the infrared spectrum, and it causes chemical changes in the cell very similar to the healing process, natural healing process. So what they do is, in actual fact, is both increase the circulation and encourage all the healing chemicals to the area and help to prevent scar tissue. But yes, it is a debatable subject because not everybody thinks that they are useful. I can tell you from many years of practice that if I use them, not with everybody, but if I use them with most people, it will shorten the recovery time and help with pain relief. But as I say, that is a big subject in the world of physiotherapy at the moment. And it's no good just doing ultrasound and laser without the exercise and without the advice. It's a whole package, basically.
So when the Arsenal players disappear down the tunnel after an injury and they go down with the physio and the doctor and everybody else trying to do something with them very quickly, what are they doing at that point?
So they will be doing a lot of soft tissue work to try and keep them moving. And I think they'll probably tape just to protect it temporarily. They will probably be using the latest electrotherapy, anything they can think of, ultrasound, laser, what else? They use various techniques, but which you don't generally see around. So anything they can do to encourage the healing will be used, because obviously, as I said earlier, it's big money, isn't it? So they need to be playing.
Big money, usually 2 doctors, 2 physios, 2 massage therapists. And
exactly.
Goodness.
They'll have their own tailored exercise program from 48 hours post-injury. No, even 24 hours post-injury. We don't tend to do anything in the first 24 hours. We let the body do its own thing. And then from there, so they will have a tailored exercise program to gently mobilize and stretch and strengthen.
I'm fascinated by the whole thing, that my club, Arsenal, were always being criticised for people being injured for too long. And now Manchester United are going through the same phase. That do the sports people know what they're doing, which is very interesting, isn't it?
Yeah, but you see, why would you let a player go back onto the pitch if he's not fully healed? Because he's just going to hurt himself again. So I understand why if they're following proper protocols, they're really waiting until that injury is well enough healed not to happen again. Because what's the point? You get them well, they play a game, next game they're off again, So
I think you've answered the question there, because Arsenal weren't doing very well in those days and the players were going back on too quick, and maybe that's been happening at other clubs because the manager's under so much pressure. Well, we've nearly come to the end of the interview, Alison. That's been absolutely fantastic. There's so much information there. Just one thing you told me last week, which really surprised me, that you had a patient at 72 who had just been diagnosed with Asperger's, 72 years old, just diagnosed with Asperger's. And you said being diagnosed had changed her life, really, because it had given her a reason for why she behaved like it.
Yes, absolutely true. So she's a lady who I've seen on and off for probably the last 5 years. She struggles with weight management and a lot of arthritic pain, and she can never stick to a diet or an exercise program. She comes back to me and she wants to have her exercises. She wants to be able to do it, but then it doesn't happen. So anyway, I don't know exactly how it happened, but she became suspicious that she might have ADHD, had all the diagnoses done, proves that she does. So her brain chemistry is a little different to some other people's. And she said it's given her permission to realize that actually she's not rubbish at doing everything. It's the way that her brain works has made things different for her. So she now actually understands that, and she doesn't get cross with herself. So she's lost some weight and she's doing her exercises. Maybe not all the time, but she's making improvements. But she did say it's changed her life and made her realize that, there's nothing wrong with her as such. It's just that her brain is wired slightly differently, neurodiverse, I think we'd call it, wouldn't we?
I think that's the latest jargon for it, but pretty amazing at 72. That's what happened. But Alison, we come to the end of the interview. We need to credit our friends that have helped us share the slides. So please do that.
Rehab my patient. Thank you very much, guys.
And finally, 3 tips for the people that need reminding on what they should be doing, please.
At the desk.
Yep.
So sit up straight, get your shoulder blades back and down, and breathe well.
Fantastic. Okay, Alison Grose, thank you so much for doing that. And can I ask members of Monday Night Live to give you the vote of thanks in the usual way? And will you stay on and answer some questions that people don't want on the recording, please?
Absolutely. Thank you very much, Derek.
That's brilliant. No, thank you for your time and a fantastic presentation. And there's lots of comments about that. I'll just stop the recording. If you've enjoyed this, please like it on YouTube or like it on the Negotiators podcast. Follow me and sign up for the programs. There's 220 YouTube videos and podcasts now that we have on here. Thanks for joining me and see you next week.